Wilms tumor. The Wilms tumor, also called nephroblastoma, is a cancer of the kidneys that typically occurs in children. Can affect both kidneys, but usually develops just in one. What is Wilms tumor?
Wilms tumor is a cancerous tumor that arises in the kidneys of children that are usually around toddler age or preschool age, and about 500 new cases are diagnosed each year in the United States.
Before being diagnosed with Wilms tumors, a parent may discover the bump in the child's abdomen because there's no many symptoms. The average Wilms tumor is 1 pound at diagnosis. Some children may have nausea, stomach pain, high blood pressure, blood in urine, or fever. Wilms tumor is a malignant tumor containing mesenchymal blastema, stromal and epithelial derivatives. The characteristics are abortive tubules of glomeruli surrounded by a spindle cell stroma. The stroma may include muscle, cartilage, bone, fat tissue, and fibrous tissue. In the diagnosis, the first sign is normally a painless abdominal tumor. You can use ultrasound, computed tomography, or MRI. The tumor have different stages. The stage number 1, the 43% of the patients have it. The tumor is limited. There is no involvement of other parts of the body. The stage 2 is the 23% of the patients. The tumor extends beyond the kidney, but is completely excised. It involves the blood vessels of the kidney. The third one, 23% of the patients, is an unresectable primary tumor. You may have metastases to the lymph node. The stage number 4, the 10% of the patients, you have hematogenous metastases. And the stage number 5, the 5% of the patients, is a bilateral renal involvement. The prognosis in the number 1, you have a 98% of 4 years overall survival. And this percentage goes like to a big probability of you to survive to a less probability of survival. What are the long-term outcomes
Generally
for
speaking,
Wilms
the
tumor?
overall prognosis for patients with Wilms tumor is very good, with survival rates of over 90%. In the long term, potential surgical complications will always include possible intestinal obstructions due to scarring from the initial surgeries.
The treatment, the surgery, nephrectomy when it's only in one kidney, lymph node sampling, and radiotherapy. What is the operation of Wilms tumors?
The surgery for Wilms tumor involves making an incision to get into the abdomen and removing the affected kidney, along with the tumor that drains to the bladder and the lymph nodes in that area. In addition, we explore the remainder of the abdominal cavity for any signs of spread. If there's a suspicion of any spread to the lung, we'll do a lung biopsy as well and look at that under the microscope to determine the remainder of the patient's treatment.
The risk factors. People of African descent have the highest rate of Wilms tumors. The most instance of cancer occurs among children between 3 to 3.5 years old. There is a genetic predisposition being studied. What are the risks or potential complications?
The most common complication after surgery for Wilms tumor is intestinal obstruction, and other less common complications include bleeding, infection, and damage to blood vessels. Another potential complication is spillage of the tumor during its removal.
Thank you.